Hello, everyone, and welcome to this TechNet 21 webinar series on capacity development and professionalization. The session today is about building leadership and management capabilities with public and private sector collaboration. You can listen to this presentation in French. To listen to this presentation in French, you need to click on the globe at the bottom of your Zoom window and choose the desired language, French. If you struggle to find it, let me know in the chat. And talking about the chat again, you can introduce yourselves and let us know where you're from and your name. And I see we already have one person introducing himself. Hi, Mohammed. Hi. And if you have any question during this presentation, please don't hesitate to ask in the Q&A box, which is also available at the bottom of the Zoom window. You can ask your question at any time, and our panelists will take the time to answer them after the presentation during the Q&A session. Finally, this session is recorded as usual, and we'll share with you the links to the video as well as the slides. The videos will be available in French and English, but the slides only in English. I hope you enjoyed this session, and I'll give the floor to Kevin. Kevin, the floor is yours.
Yes, and thank you so much, Alexandra, and welcome everybody. We're very encouraged to get this opportunity to speak with you today about our program. So Ronan, next slide. Today we have a panel that will be discussing a Gavi program called STEP 2.0. And your panelists are myself, Dr. Patricia Bobo from Zambia, and Ronan Terade from the People That Deliver initiative. And I'll let them each introduce themselves, as they take their share of the panel discussion. I myself am a consultant, supply chain consultant for Gavi. I'm also the author and project leader for the program that we're going to discuss today. So now, Ronan. So our agenda today, we're going to start out discussing the challenge that we all face in leadership and management. We're going to talk a little bit about the program development and history of STEP. Then we'll get into STEP 2.0 partnerships. It's an exciting part of STEP, so we want to explain all that to you. We'll explain what the PTD STEP 2.0 hub is and what its role is. And then once we get through all of that, we'll really do a deep dive into the program details. One of the things that we really appreciate TechNet and these webinars is that it gives us an opportunity to really dig a little deeper into the different issues, into the different strategies, and more than just kind of an introduction. So we'll spend quite a bit of time there talking about the details of the program. Then we'll transition to the Zambia experience. Dr. Patricia led the STEP 2.0 program in Zambia, and we've invited her in to give her comments and her thoughts on the program. And of course, finally, we will open the session up to questions and answers. And as Alexandra said, you've got that QA box at the bottom. Please, as we go through, log your questions there. And then prior to opening it up completely, we'll go through those and see if there's some that we may have answered or may not have answered. So with that, let's jump right in. And Ronan, let's talk about the challenge. So here's what we're wanting to talk about today. Everything begins with a challenge with STEP 2.0. And we ask quite directly, how do your supply chain leaders, face supply chain challenges that have defied past attempts to solve them? And that's critical. What we developed this program is to help solve problems that we've not been able to solve in the past. So you'll see how that kind of unfolds. Do your supply chain leaders, how do they mobilize people to drive real transformational change in the health supply chain? We ask another question: how do you lead during times of uncertainty and ambiguity? And what better time to be coming to this webinar? We've just come off of 2 years of extreme uncertainty and extreme ambiguity. And it's still out there. So, we think this program is very helpful for that. But do your supply chain leaders welcome a new way to connect, lead, and learn with other public and private practitioners? We think our solution to this is a program that we call the Strategic Training Executive Program. So that's what the acronym STEP stands for, Strategic Training Executive Program. And our elevator speech is simply this: STEP is an innovative change management process that's embedded in a 21st century team-based leadership development program that's designed to solve the complex problems of 21st century challenges. So that's where we are. That's why we did what we did. And yeah, next slide. You're fine, Roland. So just real quickly, I don't want to spend a lot of time here, but I do want you to know that this has been a program that has been in existence since 2016. The apologies for my cohort. Apologies, my work partners seem to think they need to contribute to this as well, so apologies. So anyway, back to where we were. The program's been in place since 2016. This map reflects the different countries that we've served during that period of time. You'll see very quickly that there's 2 versions of STEP. Some countries have had the benefit of going through both. Some are with the original version, and then others are with the revised version. But just some real quick stats. So far, we've served 29 countries. We're north of 500 public health professionals that we've trained up, and that included more than 100 private sector coaches. We've now expanded, and you'll see that coming up to 3 additional donors. So there's 4 donor programs that, 4 donors that offer this program. We have 8 plus implementing partners. We're adding implementing partners all the time. There's 3 delivery modes, and it's available in 4 languages. And we'll hit some of those last points in the upcoming slides. But the biggest thing that I want you to take away from this, it's a program. This is not a pilot program. This is a program that has been tested. It's been around for several years, and it's been recently improved and expanded. Next slide, please. So we talk about partnerships. This is the one thing that STEP 2.0 really tries to leverage. And when you think about that top box, this is our guiding light. STEP 2.0 is a collaborative public-private partnership, and it's designed to bridge the best practices of both public and private health professionals through a collaborative, team-based problem-solving leadership principles, again, to solve operational challenges that have defied resolution in the past. So the key point in that box is it's a public-private partnership. And it's designed to, again, go solve problems that we've just struggled with solving in the past. So STEP 2.0, the second version of the program, was developed and collaboratively across a wide range of contributors. And I'm not going to name them all there, but you can see there's, donor organizations, there's UN organizations, there's implementing partners, there's a private sector role. But not only that, this is also done collaboratively between North and South, and between West and South. So there were many voices that went into the redesign, the positioning, the re-engineering of STEP as it evolved into STEP 2.0. And lastly, the last point in the very bottom box there, where it's now offered, this is no longer just a Gavi program. We have 4 donor organizations that offer STEP. It's Gavi, the Global Fund, USAID, and IFPW. IFPW is the International Federation of Pharmaceutical Wholesalers, if you don't know them, but they're a large industry advocacy group. And then for our, for our purposes, for Gavi's purposes, for TechNet's purposes, the implementing partners that Gavi uses are Yale, Village Reach, the Empower School of Health, Logivac, Ganesh Aid, Celsius Consulting, and the Geneva Center for Security Policy. And we'll come back to those names toward the end of the slide, just to remind you of who you might be able to work with should you be interested in moving forward with this program. Next slide. And with that, to talk about partnerships, I'm going to turn it over to my colleague, Ronan, to talk about people that deliver and their role with STEP and STEP 2.0. So Ronan, over to you.
Hi, everyone. So my name is Ronan Tirad. I'm a project officer at People That Deliver. I'm responsible for the coordination of the STEP 2.0 program. So who is People That Deliver? People That Deliver is an organization established in 2011 to advocate for a systematic approach to human resources for supply chain management. So we are a global coalition building on the experiences of its members to provide support and advocate for change at a global and country level. So our objective is to create a competent, supported, and adequately staffed supply chain workforce that is deployed across the public and private sectors within the health systems. So our coalition includes 28 members with 7 different constituencies that you can see here. So among them, we find governments or other organizations representative of low and middle income countries. We also find donor governments, agencies, foundations, multilateral organizations. We can find non-governmental and technical organizations, but also academic, research, training institutions. We find professional associations, and to finish with, private sector organizations. So all these members of these different type of organization form People That Deliver. So the hub, the STEP 2.0 hub. So PTD is the coordinating hub for the program. So PTD is responsible for oversight of the program, knowledge and content management, monitoring and evaluation, advocacy for demand generation at country level, donor coordination, and institutionalization and accreditation of STEP 2.0 into training institutions and university. So all those aspects are managed by People That Deliver for the success of the STEP 2.0 program. And with this, we're gonna see the program details with Kevin.
Sure, and thank you for that, Ronan. Obviously, and apologies for not having my camera on earlier. I just saw that when I went to turn it off. Obviously, if you're going to coordinate activity across 4 donor organizations and multiple implementing partners, you need a third-party governance body. And that body is literally PTD. And were it not for the PTD hub and the support that they have, we would not be able to coordinate this program and deliver this program as it's intended across those multiple donor organizations. So let's get into the details a little bit. We said we'd spend the first 10, 15 minutes talking specifically about kind of the history and introducing you to STEP, but we want to take this next 20 minutes and really talk directly about the details of the program. So STEP 2.0 begins with a challenge. And we talked about that. And so when you think about enrolling in STEP, when you think about becoming and participating in a program like STEP, it all starts with, what do you want to use the program for? What problems do you want to solve? So before we even begin, as a participant, as a country, as a region, we ask you to think about your challenge. And we go back to that box. That little box there refers back to that slide that I said. These are the challenges that we're seeing. So there's 7 steps to STEP. You'll see us use STEP a lot. The first thing we do is identify your challenge. Then it's all about gathering information about the current reality of the situation. We have a process to identify the relevant stakeholders, but also other invested groups. And these other invested groups is often left out when we think about the different parties that are involved in transformational change. Our next step was to develop a preliminary plan for action. We get those plans peer reviewed, then we implement, and then we actually realize real transformation, evidence-based transformation, so that we can celebrate and we can award a certificate of completion and adjourn, the program at that point. So that's the 7 steps. But the key point here is it all starts with a challenge. This is not a program that is training for training's sake. This is a program that intends to have real impact and measurable real impact. You saw on the previous slide, PTD is responsible for measurement and evaluation. That's one of the areas that we feel very strongly about the revised version of STEP that we call STEP 2.0. Next slide, Ronan, please. So to solve the challenge, we know that we've designed STEP to really focus on 3 key areas that will build on an individual's leadership competency and their leadership knowledge. That first area, we spend a lot of time helping the participants in our program understand themselves, understand their motivations, understand their personality styles, and how that impacts the way they lead, how it impacts the learning style, how that impacts how they lead. And you see those, I'm not going to read every word on there, but those are a series of assessments that every individual goes through during a phase of the program that we call program preparation. And if you think back to the 7 steps that were on the previous slide, this is really that first 4 steps. Those first 4 steps are really done at the individual level, but we're preparing and planning with you to be successful with this program. So in order to do that, in order to be successful, it is essential that you understand yourself and how you fit into these different, and how, the details of you fit into the different leadership styles that's needed for a team-based problem-solving style of leadership. Then the next part is really the academic part, and we call that the practical part. So it's what you learn about yourself, it's what you learn practically, and then it's how you apply it. So under the practical section, we talk about, we deliver 21st century leadership skills and competencies that's paired with a time-tested change management theories. And we divide all of that up, the leadership skills, between lead, shape, plan, act, and evaluate. You will see that coming up in a minute. We'll dig a little deeper into that. But we call this, this is that step 5. And if you remember, step 5 was all about peer reviewing, peer interaction. All of this takes place in a workshop. So the workshop itself is 5 days. And it's during this workshop that we're learning and practicing the skills that we're going to need to solve our transformation challenge as we move forward into the adaptive period. So the self-awareness, the self-evaluation, the planning, all of that occurs in a period of time, 4 to 6 weeks prior to the workshop. The workshop is 5 days. And then once you leave the workshop, there's an application period where you're actually applying the skills you've learned, the tools you've picked up, to solving a real world problem. And that period of time really varies. We've learned over the course of our experience that 3 months is probably a minimum period of time after the workshop to actually impact and affect measurable evidence-based change. We've had some programs that have gone 6 months after the workshop. So that's really a discussion and that you have with the people that are supporting and sponsoring the program. But at the end of the day, the application phase is really about getting evidence-based real-world impact. And you can see some of the areas that we focus on there. The tools that we use is what we call a starting fast plan and an adaptive action plan. And this is really about putting your new skills and plans into action to create transformational change. So just wanted to kind of summarize real quick before we get further into the details. It all starts with a challenge. And to help you solve your challenge, we focus on 3 areas of leadership knowledge capacity building. Okay, next slide. Okay, so exactly what are those skills and competencies? We've organized it here in a kind of in a quick reference chart. You'll see again that lead, shape, plan, act, evaluate. That's the cadence that we run through the entire program. Lead refers to how you build your, how you identify the challenge, create the vision. Shape is how you build your team. Plan is how you put together an effective starting fast plan, an effective adaptive action plan. And then of course, act is actually initiating those plans. And lastly, the evaluate piece is all about how you measure the success that you have with the program. All of these skills are what we would traditionally refer to as soft skills. And just to give you an idea of where these soft skills came from, again, PTD plays a critical role in this, in that in 2014, the People That Deliver Initiative published a compendium for a competency compendium for professionalization of health supply chain management. And within that compendium, there were 7 different domains. 5 of them were technical domains. 2 were what we would call soft skill domains. And it's those soft skill domains that we are, that this program was built around. And so that gives you an idea of the different leadership skills and competencies that we have woven into the program and are used to transfer and increase the participants' capacity and leaderships. Okay, next. So those were the, those were the different capacities and all that. We focus on competencies, not capacities, sorry. Those are the different competencies that we focus on. But remember, it's also a tool. It is a tool. And so the program is built around 3 separate models. The first model is the PTD's theory of change. And you can dig a little bit deeper. And in fact, I think we have an upcoming TechNet webinar that digs deeper into PTD's theory of change. I would absolutely encourage everybody to attend that. But then we have 2 other models that we use. And one of them is this leadership development model that we call stages of team development. And some of you may have heard of this. It's forming, storming, norming, and performing. But we actually, use that model to help shape the way you approach leadership. And then finally, the hard tool, the model that we use, the model that we emphasize to make change happen and make change stick, is something that's called the Cotter's Change Management Model. And as you see there, it's, you may not be able to see it, but it's 8 steps. And we walk you through what each of those steps are. So those are the 3 models. I wanted to go back to the top there, and we call our program Strategic Training Executive Program, but STEP could mean something else. It could mean Strategic Transformational Experience Program, because that's what it's about. First of all, it is an experience, and it is all about transformation. But then somebody else might suggest that it's actually Strategic Team Engagement Program, because that's where we're wanting to move this professionalization within the supply chain. We're wanting to move away from the top-down command and control method of leadership that has been so prevalent, across, all forms of management for so many years. And we want to move that to a team-based program. I put a note there underneath, those different iterations of STEP, just to remind us that STEP 2.0 is a public-private partnership, team-based problem solving, okay? We built the program around 2 core principles. First core principle is that adults learn best by immersion into facilitator-guided peer-to-peer experiences and simulations. So that's what the workshop is itself. The workshop is not like this TechNet presentation that we're doing for you. It's not just a bunch of PowerPoint slides with somebody up in front walking you through them. We do a lot of exercises. We do a lot of team building. We use facilitators. We do not use instructors. Much of the learnings occur peer-to-peer. We learn from each other. And we do that because we know that's how adults learn. Our second concept that we know from adult learning is that it's best experienced through multiple diverse sources and voices. So in other words, we are at our best when we have the diversity of input, the diversity of opinion, the diversity of ideas. So we use many voices during a program. And there's a list of them there, but during the program, you'll have individual self-directed study. You'll have private sector coaching, both at the team level and the individual level. There's staff and faculty coaching. There's multiple facilitators. Once you enter our program, there's not just one facilitator. It's not just Kevin. It's not just Ronan, but you'll have a panel of facilitators, because again, we know that's how adults learn. So you'll see that, and then the different experiences are spread across. So that is those last 2 slides. If I can summarize, the first is a list of those soft skills that we've identified that we want to build capacity in. And this slide gives you the details of how we do that with the soft skills. These are the models that we use. These are the assumptions that we made in building the program. Next slide, Ronan, please. So now, some of the details. And I mean, we're getting into the weeds here, folks, but we could get deeper into the weeds if we want to. Program preparation. I told you that there's an aspect of the program at the very beginning, 4 to 6 weeks ahead of the workshop. We have what we call the program preparation phase of the program. And it's literally preparing you to be successful with STEP. That's the whole reason you're going through these 6 exercises. And you can see them there. And basically what this looks like is each week you're directed to either you'll get an email with a certain lesson plan on it, or some of our providers, you're directed to a site where you can enter the information, through one of their learning management modules. But anyway, the key point here is that in preparing to be successful with STEP, you have to do these 6, you start by doing these 6 exercises. And I put at the bottom, who's joining you on this journey right now? Well, right now it's just you. When you're preparing, it is literally just you at this point. Next slide. So now we've prepared, and now we get to the workshop. And this is when it gets exciting. You join, 20 or 30 of your additional peers, you're put into teams, and you attend a 5 full-day workshop. And it's the intent of this workshop to learn and practice the skills, to learn the skills, practice the skills to be successful with STEP. And I'm not going to go through each of these, but what I want you to see is that each day is divided into 4 different sessions. So in all, we have 20 sessions that you would go through across the whole 5 days. And you can kind of see, and again, you see that lead, shape, plan, act, evaluate. Every day builds on the previous day. Every session builds on the previous session. So that's what that looks like. And at the bottom, who's joining you? Well, now it's not just you. You've now joined with additional peers, with private sector coaches, with facilitators, and with faculty or staff. So at the workshop, there's a lot of people and a lot of voices and a lot of interaction. So this is where you learn and practice to be successful with STEP. Let's look at one of the days. So I told you each day's got 4 sessions. Let's look at the next slide. So this is how the day's been broken down. Again, we're learning, we're at the workshop to learn and practice to be successful with STEP. So this is what a day would look like. This happens to be day 1. And so you see the 4 sessions across the top, but each session then is divided into 3 modules. One of the things you'll see with STEP is it's very rapid paced. If you did the math, each of these modules should average about 90 minutes each. So it happens real quick. Each of the sessions lasts 90 minutes each. So the modules happen real quick. The modules are 20 minutes, 30 minutes, 40 minutes in length. Some of the modules are literally presentations. A lot of the modules are you're working in your teams. But again, it's rapid, fast-paced. We're typically changing facilitators and speakers with every module. But what I wanted you to understand from this slide and what we're trying to demonstrate is that those 4 sessions are then divided into additional modules to experience. And the last thing across the bottom is, we've taken the time to say, okay, with each of these sessions, what are those core competencies that we're highlighting, that you should be able to draw from with this? And that's what that bottom focus area piece is. Again, this is you're with yourself, your peers, your private sector coach, the faculty, the facilitators, on. Next slide. Now, you've done the program preparation piece. You've attended the workshop, and man, you're wiped out. You are just spent at this point because it's a lot. I mean, it's a whole lot. But guess what? It's a lot because our jobs are a lot. One of the critiques that we get very often is that, if you could just slow down, if I just had more time. Well, unfortunately, we say the same thing in our jobs. If I just had more time to do the job. So part of the practicing that we do, is to figure out how to prioritize and, make change happen within the limits that we have. So anyway, you've gone to the workshop. Now it's time to enter what we call the post workshop or the implementation period. And this is where you're literally implementing and hopefully having success with STEP. It's broken out into really multiple phases. Like I said, this could be 3 months, this could be 4 months, it could be 6 months. That's really a decision for later on. But the one thing I wanted you to see from this slide is that coming out of the workshop, you will have an actual, what we call starting fast plan. And those are the quick hits. And if you went back and looked at the model, you'll see that model actually calls out, let's do some things. Let's do the easy stuff first to get success, because nothing breeds success more than success. But we also know that once we're into our implementation, that we have to pause and reevaluate our plans. And so there is a transition after about the first month or the first 6 weeks of the implementation period, where you'll stop, reevaluate the plan, reprioritize, and adapt the plan. And again, at this point, you're with yourself, it's your coach, your private sector coach, and now your work team that you've gone back and built. I've only got one more slide after this. So all of that said, that was all the details of the program. Now I wanted to just really quickly call your attention to something that I said at the very beginning, in that there are 3 modes of delivery for this program. And that's what those 3 arrows mean. And I'm not going to get into too much detail with them, but what I want you to understand is that top model, what we call the traditional model, it's what's known as STEP 2.0, was everything that I just covered: program prep, workshop, post-workshop, in that order. It's available in English, French, Portuguese, Spanish. So that version's available. There are workbooks, there's slide decks, there's exercises, all of that. However, one thing that the pandemic taught us is that we needed a virtual version. We needed to be able to engage when people aren't able to be in a workshop scenario. So that's what that second step that we call the virtual model, we call that V-Step 2.0. And essentially the difference there is that it's a much longer program because you're doing it through webinars. So it's a program that is anywhere from 20 to 24 to 30 weeks in nature. And because you're doing short weekly webinars all the way through, and you're working on your self awareness, and you're working on the practical and the application a lot at the same time, or in very close. So it's not as compartmentalized as the previous version. So, and that is available currently in English and French. The last model that we did, and this was something that we learned from our Zambia experience, which will be the next area that we go into, is we learned that sometimes virtual coaching, the private sector coaches coaching virtually could be done better. So we created a hybrid version of STEP. And we call that H-Step 2.0. And really the difference is it's the virtual program. However, we incorporate a piece of in-person private sector coaching. So you still attend, the practical part virtually. You do all your, there is a virtual component to the coaching, but there's also this in-person component to the coaching experience. So, and that again mirrors the availability in English and French. Okay, next slide. All right, was Dr. Bobo able to join us?
Yes, Kevin, I'm here.
Yes, she's here.
Okay, then I turn it over to you, and thank you so much.
So thank you very much, Kevin, and good morning, good afternoon, good evening, everyone. My name is Patricia Bobo. I'm joining you from Zambia, and just to share briefly our Zambian experience of the virtual step 2, like Kevin said, ours was purely virtual. And just to go straight into the presentation. So what you see there is, these are the details of the candidates, all the people who participated in the virtual step. And just an overview about the country, we have 10 provinces, and we made sure that we had participants from all the 10 provinces represented. And also you might want to know that some provinces are mostly rural, others mostly urban, and others a mixture of both. And of course, the issue of having stable internet becomes, very critical, and also finding time to actually do this. But also, just to take you back to what Kevin mentioned, the issue of always starting with the question, the challenge. So what was our challenge? And for us, that was very important. And like he said, we had this virtual step going on at the time of, at the peak of the pandemic. And there were a lot of challenges. But I think to summarize the challenges, it was basically COVID-19. And I'm sure most of you can actually relate with what that really means. Our staff were demoralized. There was a lot of things happening, too much work, too much death, and COVID isolation, restrictions, a lot was going on. And so it was actually important that we had this opportunity to bring people together. And in all, we had 30 people joining in. I hope you can see all the provinces, like I said, were represented. And we also we made sure that we had people coming in from the national level. That is from the Ministry of Health headquarters. And these were also learning, but also just to motivate the staff and make sure that they identify all the other issues and just move together with the team. And as you you can see from the slide, we had a mixture of pharmacists and logisticians, cold chain officers, and other expanded program on immunization participants. And of course, like was mentioned, we had international coaches. And like I said, again, all the 10 provinces were represented, plus the central level, which is the Ministry of Health headquarters. Next slide. So this is a mixture of the people, the coaches, and so basically this is a group photo that was taken at the end of the session. So we never got to meet in person, but it was actually very nice that we did actually meet virtually like this. Next slide. Okay, so like I said, the general topics were basically, the major issue was around COVID-19 and the pandemic itself. And also we had people talk about COVID-19 vaccination. And when you look at the general topics that were covered by our participants, 4 covered issues to do with improving COVID-19 vaccination coverage. And I must state that at the time of the training, I think we were around maybe 20% somewhere, of the eligible population who had actually been reached. But things have changed. I'm happy to say that by now, Zambia has actually reached 76% of the eligible population, which is a big plus for us. And the other popular topic was around logistical utilization. So this was an online system that we were using for management of immunization data and also stocks. And we believe that if people followed it, used it optimally, they were actually going to manage their stocks better, as well as immunization data much better. But the utilization was suboptimal. And others, again, on management of vaccine stockouts. Again, it was a very popular topic. As you can see, 7 of our participants actually took that up as their topic that we're looking at. Management of cold chain equipment, we had 3. And again, that was a very big issue at that particular time, especially that we had all these vaccines coming in, and some of the vaccines were new to us. We're looking at vaccines that required outer cold chain, things that we never had before. So there was, there were a lot of issues around that. And of course, vaccine wastage, government funding. Somebody actually did talk about that. It is a big issue with a lot of things going on. Priorities changed, and were we going to sustain government funding? Those were questions that people were asking. And also issues of staff retention, especially the people that we work with, the volunteers, and all the other staff. How do we make sure that we keep them motivated and they're able to actually continue with their work? Next slide. Okay, so in summary, that was our experience as Zambia. Thank you so much.
And I thank you so much, Dr. Bobo. And it's been just such a refreshing pleasure to work with champions like Dr. Patricia during this. The one thing she didn't tell you is that she actually came to, was working with one of our implementing partners, Yale, for example, and had participated herself in another Gavi-sponsored Yale implemented program called EpiLamp. And it's a sister of STEP with less focus really on supply chain and more focus on the overall immunization programs. And so that could be a topic for another TechNet session next year. But Dr. Bobo had such a great experience with EpiLamp that she and had heard about STEP that she wanted to bring that into her country. So I know one of the questions that we're going to have is, how do I get that? How do I, what's needed to actually get STEP, to get a STEP program implemented in my country, in my region, in my area? And I will tell you, the very first thing you have to have is a champion like Dr. Bobo. You have to have, and by champion, I mean, you need a high-ranking official that with a lot of influence that can help drive the program, in your area. Absent that, it becomes very difficult to actually get a program up, and more importantly, to get a program to be successful. That's the other piece. Her involvement, literally week to week, and all of the review meetings led to that impact. And you can't have a greater impact than saying you moved from 20% coverage to 70% coverage. Now, we're not saying STEP was the sole reason for that. There were many reasons for that, but STEP contributed. In some of those districts where the folks were, the participants were tracking their coverage rates, they were able to increase coverage based on what they learned at STEP. So that's what we're talking about when we're talking about challenges and when we're talking about evidence-based transformation. So I know we're running real close on time. Alexander, I've got 4 questions here in the Q&A that I'm going to just go down one after another.
Go ahead.
And yes, and answer, and then I'll open it up to the floor if others want to, ask. So it says, any plans to facilitate the step 2.0 in Arabic? I'm assuming that the reference there is, are you going to translate it into Arabic? And thus, oh, okay. Alexander would like to answer this question.
No,
okay,
sorry,
Alexander.
I just meant it's answered live. Go ahead.
Okay, I thought, okay. Happy for Alexander to jump in there.
No, go ahead.
Yeah, so currently the Arabic, the market, I mean, the countries there, the Arabic countries, you saw on the map, that's a hole that we're missing. We would love to bring it to our Arabic nations and our Arabic countries and friends. It all has to start with, where the demand is. And so the question about translations and why these different versions are translated the way they are, it all goes back to funding. So in other words, there have been organizations and countries that have underwritten the translation out of English into their native tongues. So that's why you see the traditional program, has evolved into not only English and French, but Portuguese and now Spanish. The virtual program, because it is so new, has just been translated into French. It's currently being implemented by USAID in Côte d'Ivoire in French, and we will go to the DRC, I believe, next year and do that French version there as well. So hopefully that answers that. We would love to go to our Arabic nations. We would love to translate it into Arabic. Okay. It says, can we have access to the link for traditional model step 2.0 for further details? You don't want the link. So all of the programs, all the program materials are held by PTD and what we call the PTD Step 2.0 Vault. And it's massive. There's terabytes of information that's in that vault. The workbooks and everything, it's very, you would just get lost in there. What we can do and what will be done for you is this presentation will be made available to you via either the recording or whatever, or shared out later. And you should have enough information based on this to really begin to think deeper about the program. As far as Gavi's EAF funding, yes, we would encourage you to, to approach Gavi. In fact, one of the questions that we anticipate, and I'll go ahead and answer here, is how do I get this program? There's really 3 avenues that you can pursue in getting this program. But remember, the first thing you got to do is you've got to get a champion. You've got to get high level buy-in on this for this to be effective. The preferred path for you to get step for your country, for your region, is to go through Gavi's various funding channels. And so you would need to work with your Gavi country program management team and identify those sources of funding that would then be available to you. So that's the actually preferred for Gavi. I'm not going to, because this is TechNet and we're all immunization, I'm not going to talk about USAID, Global Fund, or IFPW. Their mechanisms can be different. But for Gavi, work with that country programs management team. But there is a second avenue that you could try, and that was the Zambia example. As I just said, Dr. Bobo was working already with Yale, who was one of our implementing partners. She asked Yale for help in securing Gavi funding. So if you have a relationship with some of those implementing partners, you could pursue a route through them. DRC went through Village Reach to engage USAID. It's another example, okay? But then there's a third avenue that you could take, and it's probably the least preferred, but it's available to you. And that is to actually work with the PTD hub, the Step 2.0, to work with Ronan, to work with Dominique. And what that would look like is that engagement would then have PTD helping identify a proper source of funding, helping identify the proper folks that needed to participate, on and on and on. So you got three avenues: preferred avenue, Gavi country programs management team to identify which Gavi funding bucket. The second would be to work with one of the implementing partners. And the third avenue is to go through PTD, okay? So give some changes, progress achieved from the baseline of some challenges concerning some of the topics mentioned. Thanks. Don't really have time to go into a lot of that, but as we said, in order to receive your certificate of completion, in order to be successful with the program, you have to demonstrate really two things. You have to demonstrate that you've adopted the team-based leadership skills that we, that we train against, but you also have to make improvement. You have to make measurable improvement on your transformation. And so of that list of 30, and Dr. Bobo may correct me, but I think it was 25 or 26 successfully met both of those criteria. So that evidence is out there. One of the things we want to do with PTD is publish, different stories, different reports. That is a work in progress. And I think you'll see a lot more of that coming in 2023. For the virtual model, how do you work around connectivity issues? Very difficult. And that's one of the downsides of the virtual model. It's and whenever we entertain a discussion, Corteva, for example, that was one of the primary areas that we work with the government, we work with the implementing partner to say, hey, is your connectivity solid enough to do this virtual program? It is very limiting in a lot of the areas that we all represent. So yes, there isn't really a workaround. We've tried some different ideas, but yeah, if you don't have good connectivity, the virtual model is likely not for you. What's the biggest motivator for the leaders in 29 countries who enrolled in the STEP program? Their motivation, they need to change. They need to change. They've been trying to solve the same problems the same way for years, and they were welcoming anything new to the program. So with that, I'm right at our hour according to my clock. I think I've answered all the questions.
There are two quick questions in the chat.
Oh, okay.
First one, what was the criteria used to choose the 29 countries in STEP 2.0? And you talked about it.
Yeah, so the 29, the 29 countries, remember that's since 2016. That's not just, STEP 2.0 has been in place since 2020. But the criteria really for the selection of the countries is literally the country said, I want this, I want STEP. So we call that the very opportunistic approach. A country, Kenya, for example, comes forward and says, I think STEP can help us. We begin to work with them on exactly how they would want to use STEP and what they would want to get done. Next question, Ronan.
Why is it not possible for individuals to be enrolled in STEP 2.0? Individuals.
You mean on their own? So that's a good point. Yes. Yeah, so that's a good point. So real quickly, the participants in our program are underwritten by donations. So in other words, the engagement and all the expenses and everything of the program are funded through one of our donors. And those funds come from funds from the donors. if that makes sense. We have not developed a model for individual enrollment. However, I will say that once we get to this, you heard Ronan refer to institutionalization and accreditation. We do see a vision somewhere down the future where this could be residing in either a professional society, a university, some professional development program where you could self-nominate. But right now, the beginning of the process begins with the EPI program for Gavi, begins with the Ministry of Health, and goes from there. So great question. Hopefully we'll be able to have that in place in the coming years, but we're not there yet.
Awesome. Thank you very much, Kevin. And thank you very much, Ronan, for your support. Well, this was an excellent presentation. So thanks again, Kevin and Patricia. We will share all the recordings in French and English, as well as the slides, by email with everyone who registered. We are really grateful for all this very useful and yeah, great information. And we'll do some more sharing also across the TechNet channel, so that we can reach more people, that even those who didn't register.
Advocate for us, man.
Yes.
Advocate for us.
Absolutely.
And I will say, right now's the time, as everybody's building their plans, their country support plans and stuff, this is the time to communicate, to get on the calendar for 2023, 2024, and so on. So yeah, now's the time to make those contacts and to make those asks.
Absolutely. Yes. So thank you very much, everyone. We have another session next week. So we hope you can join us same time, same day. So on Thursday next week. The topic will be building digital capabilities in enhancing supply visibility, design, and smart optimization with a country example. That's it for today. I wish to thank also Fred Palazzi for his organization and Emily for the interpretation. And I wish you all an excellent rest of the day. Thank you, everyone, and see you next time. Bye.
Bye.